Hello, my name is Hannah, and today I'm going to be presenting the findings of my single subject design project entitled Exploring the Effectiveness of Dialectical Behavioral Therapy and Addressing Workplace Anxiety Presentation. As I said, my name is Hannah Baker. My professor is Minyoung Lim, Dr. Lim. The course for this is Social Work 579, Portfolio and Social Work, and I'm happy to present and kind of explain what I've been learning and integrating. To go over what I'm going to go over in this presentation, I'm going to go over a client overview and introduce you to the client that I've been working with. I'm then going to go over a literature review and discuss different reasons why I found DBT to be an important intervention. Um, and then I'm going to go over DBT interventions as a whole. And then I'm going to go over the interventions that I use specifically with Bill in this design, in this study. And then I'm going to go over the methods, the findings, the figures, the implications, the limitations of this study. And I'm going to dive into a little bit about how the integration of DBT skills in environments other than intensive outpatients or partial hospitalization programs could be beneficial in a justice-informed social work lens. And I'll talk a little bit about how some of the research I found shows how this could work for individuals who are incarcerated, and how DBT has helped reform some practices in their life. And then I'm going to talk about the faith that I'm going to be putting into my practice just a little bit, and then I'm going to conclude. So to start off, let's go over the client that I was working with within this study. His name is Bill. He's 31 years old. He's male, white, speaks English, and he's the manager of a medical clinic. And he's currently in charge of all of the staff, all of the operations, and everything that has to do with maintaining a medical clinic. He's in charge of it. So he's in charge of making sure the medications are, up to date and stored correctly. He's in charge of making HR decisions, hiring and firing people. And as we learn a little bit more about Bill, you can see as to how working in such a stressful environment definitely comes with its challenges and can lead to some symptomatic presentation. So some behavioral observations and presenting concerns for Bill. Bill is currently presenting with psychological and somatic anxiety and panic symptoms throughout the workday, and this symptom presentation is affecting his emotional regulation and professionalism in his work environment. So to delve into a little bit more about Bill's symptoms, so as I said, he's currently presenting with psychological and somatic anxiety symptoms, and these symptoms throughout the workday present like sweating, rapid heart rate, unable to control body temperature, the inability to regulate certain emotions, irritability, emotional outbursts, etc. So he is currently suffering, and as he said, it's affecting his emotional regulation and professionalism, and this is something that he is wanting to change. To go over the literature that I reviewed to support my hypothesis, I found a lot of research that supports a lot of mental health issues in the workplace, specifically anxiety, and they do name this as a mental health phenomenon. They go on to say that workplace phobia is a phobic anxiety syndrome characterized by psychological, arousal when confronted with the stimulus, workplace in vivo or sensus, and a tendency towards workplace avoidance. And I thought this was completely fitting in Bill's case, as he definitely is in a hyper-aroused phase in the workplace, especially when he's facing emotional challenges and inability to regulate emotions, and then presenting with irritability and emotional outbursts. This affects Bill in multiple negative ways, including losing some trusted relationships at work, uh, having feelings of embarrassment, guilt, and shame after having these outbursts, things like that. And then I also found some research that supports DBT in its core value mindfulness, and how this in the workplace is beneficial. And we'll go over some DBT skills in general that I think would be beneficial in the workplace and in a lot of different environments. And then we'll go over the ones that Bill found was most necessary to his success and recovery in this study. So my hypothesis for this design study is that I propose that with added DBT interventions from each module, my case study example, who's Bill, will be able to lessen his workplace anxiety symptoms by implementing the skills that work best for him. The specific treatment goals for Bill will be to lessen anxiety symptoms as recorded by different anxiety assessments, as well as lessening somatic symptoms throughout the workday, including rapid heart rate, sweating, and disorganized racing thoughts. I am hopeful that Bill will be able to enhance his quality of life with the implementation of DBT skills, as well as his professionalism in the workplace. So all of that being said, in kind of a more summarized way, I do think that with the added DBT interventions, it gave enough variety for Bill to really latch onto interventions that did really work well for him. So when I was implementing these skills over a 4-week period, I would introduce a couple skills from each of these 4 categories. So these are the 4 main competencies of dialectical behavioral therapy, and this is what is taught in the IOP that I'm currently interning at. So I do facilitate a full DBT group, and I do individual DBT therapy. And there are multiple skills that you go throughout in the handbook and you learn every week. Each person who's in DBT is in 1 hour individual sessions a week and 2.5 hour group sessions a week. So each of these 4 competencies have a lot of different skills, but since I was working with such a brief time frame and I wanted to get all 4 categories in to working with Bill to aid in his success, I wanted to make sure that I wasn't, not being able to get to one of the core competencies. So I just took a couple skills from each of the competencies that I thought would best work for Bill, and so yeah, I'll go into a little bit of an explanation of the 4 competencies. So mindfulness, the skill focuses on being present and aware of one's thoughts, feelings, and surroundings without judgment. It helps individuals to observe their experiences without reacting impulsively. And in mindfulness, you're going to see skills a lot of time, like meditation, paced breathing, anything where you're kind of wanting to get your thoughts away from whatever's at hand that's giving you negative symptoms. So really anything can be mindful. That's what we say in our groups, that you can do anything mindfully. Like for example, you can mindfully eat. Every mindfulness skill is created by kind of three different things. So it's observing, describing, and participating. So if you can observe, describe, and participate in something, then that would be something that would be a mindfulness skill. So a lot of times in group, we're doing things like mindful coloring, mindful breathing, mindful meditation, guided meditation videos. There's a lot of ones on YouTube that we like to access, and there are some by Marsha herself in the handbook as well as online. The next core competency is distress tolerance. So this skill teaches individuals how to cope with difficult situations and emotions in a healthy way. It involves learning to accept the present moment, develop crisis survival skills, and soothe oneself. And in distress tolerance, we get to a lot of the um, Buddhist teachings that influence DBT. Marsha Linehan, who's the author or the creator of dialectical behavioral therapy, she needed individuals to learn to accept the moment that they were in, and so she would work with the monks, and she actually went over and did a stay at a monastery. And to learn radical acceptance, she was like part of their work day, and she would have to do different chores, and she would have to accept that, okay, that's the chore I have to do for the day. And she tells one story of how she's sweeping, right, and uh, then a bell goes off, and then you have to stop your chore. It doesn't matter if you're halfway done with your chore, and that was really hard for her to let go of. And I think that kind of shaped how radical acceptance came to be. It's just accepting that at that present moment, that is what it is. Um, and a lot of times this gives validity to people who are going through moments that are really, really hard. And so distress tolerance is something that is incredibly complex and philosophical and really fun to learn about. But in Bill's case, in this study, Bill doesn't really have any safety concerns. He mainly is focusing on how to regulate his emotions and how to, strengthen relationships with other people. So a lot of the skills that Bill was working on are in mindfulness, emotional regulation, and interpersonal effectiveness. We didn't get to too much with Bill on distress tolerance or radical acceptance or anything like that, but I think that is a really big part of DBT, and definitely something that I gave Bill resources on if he's ever in need of it in the future. The third competency is emotion regulation, and the fourth competency is interpersonal effectiveness. So emotion regulation, this skill helps individuals to understand and manage their emotions in a healthy and effective manner. It involves learning to identify emotions, label them, and regulate their intensity. In interpersonal effectiveness, this skill focuses on improving communication, assertiveness, and relationship skills, helps individuals navigate social situations more effectively and build healthier relationships. So these two competencies we focused a lot on with Bill, especially as one of his targeted behaviors was wanting to regulate his emotions. And yeah, I will go on to the next slide where I'll kind of explain the specific interventions used by this client. So in mindfulness, we introduce pace breathing and meditation. So pace breathing, it's going to be where, we usually follow a guide, but it's going to be breathe in for 4 counts, hold for 4 counts, breathe out for 4 counts. That's called like boxed breathing. And Bill reported that this worked really well, especially because he was able to do this during the workday where he's not, it's not going to cause a disturbance, right? You could even do it during a work meeting or like a Zoom meeting. Another skill in mindfulness is meditation. This worked a lot for Bill, especially just doing it for like 3 to 5 minutes a day. Something that he was able to do like on the drive home after work. And this was reported as a high indicator of assisting, especially in moments when panic or anxiety symptoms were super high. The TIP skill, so that's a distress tolerance skill. And I introduced the TIP skill to Bill to specifically work on panic symptoms that he may experience during the workday. So he experiences panic somatically, where his heart is beating rapidly. He is maybe unable to speak sensibly. He's shaking. There's a lot of things bodily that come up, a lot of tension, right? The list goes on. But the tip skill is used to change your temperature. So either going to hot or to cold. And when you go to cold, that initiates the mammalian diver response. So all mammals have a diver response where they know that if they go in water, they can get away from the predator, the land predator. So when you cool down your body, like in DBT specifically, we use ice packs where they're able to put it over their vagus nerve, over their chest, or over their sinuses. This is used in a pinch to really help individuals who maybe are experiencing panic symptoms and maybe bodily symptoms that they cannot control. And this also was reported during the days that Bill used the tip skill. He definitely saw a difference in the lessening of anxiety symptoms. Dear Man is a script-based intervention where you fill it out, and it's basically planning for a argument, or not necessarily, it doesn't have to be an argument. It could be a discussion that maybe you don't know how it's going to end up, but it's basically for you to kind of plan out how you want the discussion to go. So, for example, Bill used this a lot in his HR life. The last 4 weeks, he's been implementing these skills, and he used it a lot to kind of plan out meetings with his superiors and his bosses. And this was also a very positive skill, and that is in the interpersonal effectiveness portion of DBT. And stop and cope ahead, they both kind of work in tandem. The stop skill is basically just stopping right when you feel either the bodily symptoms come up or you start having any psychological symptoms that also may come up. You stop in that moment and you change the environment or change the way you're thinking. So that could look like removing yourself from the room to go use the restroom, taking a minute, and then coping ahead, planning out how you're going to move forward, right? So going through these interventions was really good with Bill, and I introduced just a couple at a time in the week, and this was the psychoeducation that was given to Bill throughout the length of the study. So this is an explanation of the methods that I used for this study. So we tracked Bill's severity of anxiety presentation in the workplace. And to do this, we integrated new DBT skills each week, and we tracked the severity of Bill's symptom presentation before and after the integration of these skills. Bill and I tracked his symptoms using a 7-point Likert scale, measuring the severity of symptom presentation between 1 and 7. And that was twice a week as well. And Bill was also assessed using a GAD-7 assessment twice a week while implementing DBT skill use in his work life. Here are the figures and explanation of the 4 weeks. And if you can see here on the left, that is before integrating DBT skills. So Bill reported that 75% of his week is he's exhibiting and presenting with anxiety symptoms. 20% of his home life in a week he's exhibiting anxiety symptoms, and 5% of the week these symptoms are not present. And then afterwards, it shows Bill's daily anxiety symptoms after introducing DBT skills after a 4-week period. You can see that his work life anxiety presentation went down to 60%. His not present days went up to 20%, and his home life anxiety presentation stayed the same at 20%. So with these findings, you can see that Bill's anxiety symptoms went down by 15%. Bill reported lessening symptoms, specifically somatic symptoms like sweating, rapid heart rate, and racing thoughts. Bill identified mindfulness skills as being the most beneficial in the lessening of his anxiety symptoms in the workplace. Anxiety symptoms during home life stayed the same at 20%. And while discussing this with Bill, he discussed why that number may have stayed the same. Bill expressed specifically utilizing and integrating skills into his work life more often than when he was experiencing anxiety symptoms at home. This was the main supporting theory of my hypothesis. The integration of mindfulness techniques to stress tolerance skills, interpersonal effectiveness, and emotional regulation techniques added to multiple days of being symptom-free from anxiety, with an increase of 15% of days not experiencing any somatic or cognitive symptoms. The limitations that I found in this study is that it is a single case design, right? I'm specifically working with one individual. It is also, there with that, there's a brief time period. So we did this over 4 weeks, and DBT usually is spread over the course of a year. So this was definitely a crash course in DBT, um, and teaching the interventions in that short of a time frame. I'm not sure how much of an understanding there was, but luckily Bill had a lot of willingness to complete these, and even with the brief time period, even though there was all of this information, we were able to try things that really did help. This was also an unconventional DBT environment. And I'll go into this a little bit more in the next slide, but usually DBT is only performed in an IOP, an individual, or PHP. So an intensive outpatient program, a partial hospitalization program, or you can get like supportive DBT therapy individually, where you wouldn't be in a group, you would just be one-on-one. So doing a crash course, one-on-one session of DBT, that's very unconventional. And it's a lot less time than is usually maintained in normal DBT. So it would be interesting to see in the future if any other skills would have been a better fit for Bill, to get those numbers down a little bit more. So I'm going to talk a little bit about adapting DBT to modify the content of the treatment. So while researching DBT and how to integrate DBT very quickly into this single study design, I came upon an article that I put in my lit review talking about applying DBT to deserving but undeserved populations. And this talked a lot about adapting DBT requires modifying the content of the treatment to fit the incarcerated population better. So this is talking about incarcerated individuals who, this has been a lot of research that have argued several points for adapting DBT for justice-involved individuals. And it's shown that DBT is the comprehension of CBT, but it has a rigid behavioral hierarchy. And with that rigid hierarchy, it can also be fit in well into an incarceration setting. So I thought this was interesting information and definitely a way that DBT can be used in different environments. And it definitely made me think about how DBT could be used in many different environments, um, and how I want to continue using DBT skills professionally in the future. Depending on, I want to continue to be in mental health, and depending on where I am, I will want to teach people DBT skills if they're willing to learn them to help in any way I can. So yeah, thank you so much for listening to me talk about DBT and how Bill was able to lessen his anxiety symptoms. I think there is so much more spaces that DBT could be applied to. I really think it's a really good curriculum, and there are definitely limitations to only being able to have it in certain environments. So yeah, thank you so much. Have a good day.